So telemedicine is actually video conferencing with the specialist that you're seeking care from. So it's providing health care service for patients who are not seen in person, but rather at distance. It's basically FaceTiming or Skyping, but with a confidential and secure network. So patients with Crohn's or colitis can benefit from something like telemedicine because it reduces the risks of disruption in terms of daily routine. It reduces the risk of stress, unnecessary burden of the illness, of needing to travel for unnecessary visits. Instead of doing a video conferencing, patients would probably bring someone else with them to the visit. Which is obviously a burden to carry financially and also time-wise. So it saves a lot of wait times as well if you are in an area with a low access to a gastroenterologist. So the PACE Telemedicine Program is funded by Crohn's and Colitis Canada. It's dedicated to serve patients in underserviced and remote communities in Ontario. It's for patients with Crohn's or ulcerative colitis who do not have access to a gastroenterologist for diagnosis or for the management of the disease. So there are multiple achievements with the PACE so far with only a few years. So the program started in June 2016. So far we have more than 200 patients enrolled in the program. Many more visits than what we started with. Now it's over 400 visits. A lot more telemedicine studios that we're using, more than 80 telemedicine studios. And more importantly, we're publishing this as also a evaluation method, so assessing what we're doing and how we're doing in the telemedicine program. So we assess the wait times and we assess the cost saving from the PACE telemedicine program, and that was published in the Journal of the Canadian Association of Gastroenterology. So it's important for the quality of care of patients that they know they're following someone, they're able to respond to their concerns. It alleviates that anxiety symptoms that may trigger also worsening of flares. It reduces the unnecessary hospitalizations or emergency visits that could happen if you don't follow with a specialist in IBD who knows you and who knows how to medically manage your situation. In addition to all of this, obviously what we spoke about is the cost saving and how to reduce that risk of wait times and potentially getting even in a more complicated pattern than what you're already in. So it reduces a lot of unnecessary healthcare utilization at the end of the day. So the goal of the PACE telemedicine program is to serve as a prototype for IBD programs throughout Ontario and throughout Canada. It's to establish this model of care that integrates patients who live in remote and rural communities and provides high quality of care. But also it can serve as a prototype for other chronic diseases, not just IBD, in Ontario and in Canada throughout. So the initial process or the initial goal was to have the other PACE sites implement the telemedicine program and then expand from there to outside. So it is very easy to access the PACE telemedicine program. There is an online referral form that is available on the website, on Zane Cohen Center website, which has a referral form in PDF format. The referral can be done for anyone who is query IBD, so that's not sure diagnosis of IBD, who is ongoing management, referred for ongoing management of IBD, or also referred for a second opinion regarding the medical management. So those are the three different referral processes that can be done. The PDF format can be filled by a family physician or a nurse practitioner, or even any specialist, any physician. And it can be faxed to the telemedicine office where all the triaging will occur, and then patient will be contacted consequently by a telemedicine coordinator from our site at Mount Sinai Hospital.